Syncope is defined as sudden, brief, spontaneous loss of consciousness with loss of body posture with rapid spontaneous recovery to baseline. This loss of consciousness typically lasts seconds to few minutes and is not associated with persistent alteration in mental status. Brief global cerebral hyperperfusion or brief hyperperfusion on the brainstem. The causes can be divided into three broad categories. Number one is neurally mediated, two is orthostatic, and three is cardiac.
We'll focus on cardiac syncope today. An important ECG abnormality associated with syncope is prolongation of the QT interval.
The QT interval is dependent on the underlying rate of the patient. In general, the slower the heart rate, the longer the QT interval, and the faster the heart rate, the shorter the QT interval. Because of these rate-related changes, a separate measure known as corrected QT interval or the QTC has been developed.
The QTC is considered prolonged if it is over 450 milliseconds in men and 460 milliseconds in women, and markedly prolonged if it is over 500 milliseconds. There are several formulas for calculating QTC. Bassett's formula is used by most ECG machines to calculate the QTC, but it has its own limitations. For example, it underestimates the QTC in bradycardia and overestimates the QTC in tachycardia. So its accuracy is limited mainly to heart rates between 60 to 100 beats per minute. At heart rates outside of the 60 and 100 beats per minute range, the Fredericia or Framingham corrections are considered more accurate. The prolonged QT interval increases the risk of Tosadi points via R1P phenomenon. The causes of prolonged QT interval can be divided into either congenital or acquired. Drugs that associated with prolonging QT includes: for acute poisoning with QT prolonging agents, the risk of Tosadi points is more reliably derived by the absolute rather than corrected QT. We use the QT nomogram here. You manually plot the absolute QT interval against the heart rate on the nomogram. If the point is above the line, the patient is at risk of developing Tosadi points.